So if someone has an extreme amount of skin laxity and is interested in doing something more aggressive than something as dramatic as a facelift, we make an incision along the side of their face and loosen up the skin so that you can pull it tighter. And then that gets rid of a lot of the laxity. But if a person doesn't have that amount of laxity, it doesn't want that sort of risk, there are less aggressive approaches, and they can range from technologies such as an accent laser treatment, which destroys some of the fat that's underneath, that pushes out the tissues, the deeper tissues, and tightens the skin as well at the same time. There's the photodynamic therapy that we talked about earlier, chemical peels. So there's a range of options that are available to try to improve the skin.
And in addition, at Advanced Aesthetics, we have some other lasers that Dr. O'Day didn't mention. We have a skin tightening laser, which uses radio frequency and laser energy. We have a different technique with the accent that he mentioned that's also used for treating localized fat. But there's another setting where it's really just tightening up the loosened collagen branches without destroying the fat as well. And we also have a treatment called, a laser treatment called the Fraxel Repair, which is actually the epitome of Fraxel treatments or laser treatments. It's an invasive laser, so it is actually lasering off little pixels of the skin, but it's leaving intact skin cells between, and it causes an immediate skin tightening. It is helping greatly stimulate collagen and elastin. It's just a really wonderful treatment. It is more invasive than a microdermabrasion by far, but it is not as invasive as a facelift. So there's recovery time with that of at least 2 weeks.
Wow.
One of the things we often try to explain to patients is when you're doing a more gentle treatment where you don't have much downtime, you often need a series of those. You need to do many of those to get an effect, or you can do a really big one where you do have a lot more recovery time. But as Dr. O'Day mentioned, the risk is greater and the recovery is greater, but the results are greater.
Yeah. Well, it's nice that they have such a vast difference that each person can individualize what they want, how long they need to be down. You know, exactly. Back in, 5 years ago, I think, maybe 10 years ago, we didn't have all of these great options of all the different variables that we have. So.
It's kind of fun. Both Dr. O'Day and I do the Fraxel, and we do some dermabrasion as well. He has done a cosmetic surgery fellowship after his dermatology residency. So he does a lot of cosmetic surgery. He does the facelift, he can do neck lifts and earlobe repairs, and what else am I forgetting? Blepharoplasties, where somebody has a lot of redundant skin, baggy upper eyelids, as well as liposuction. I may be forgetting a few, I can't remember offhand, but it's really nice to have the full. Definitely. We always make sure we are going through that with everybody. But yeah, it's really nice to have the whole range of minimally invasive to quite dramatic procedures. So. And they're all done at our office, and we have an outpatient surgery. Well, we have actually 4 outpatient surgery suites. So it's safer procedures where you're not having to go under general anesthesia. So.
Wow. That's great. So now with all of these variable treatments, and I'm assuming that they're all permanent, so there's no going back, right? So.
I have to qualify that permanent, though. I do. They are permanent. They are really affecting change, and they are making a permanent change. But I always have to qualify that because once in a while I have a patient who will want me to stop all aging. And the only way to stop all aging is actually to die. So I always kind of joke a little bit that, well, we don't really want to do that. Because as long as we are alive, we are going to continue to age. So we can't prevent the formation of further wrinkles if you're going to continue to contract or your skin in a certain way or go out in the sun quite a bit. You are going to continue to develop more wrinkles, more sunspots and things like that. But what we're doing is we're permanently affecting those changes and improving your skin all along.
So you're helping us do it gracefully.
Yeah, that's the goal. Really, that is.
You know, because I don't mind getting older, but I like to do it with grace. You know, exactly. And you know, be the best I can by eating healthy and exercising and doing all of the preventatives, like you said, from the inside out. So that's really great. So good to know. When you were talking about, you know, spots on your face, it just kind of triggered a thought about age spots. So that's my next question about how you trigger age spots and or any discoloration, because I know as we get older we'll get the marks on our hands, and Grandma and Grandpa always had them.
Yeah. They used to be called liver spots, and they had nothing to do with the liver. But I don't know if they're liver colored or something, they got that name. But we actually refer to them as sun-induced brown spots. And they're really the result of your lifetime accumulation of UV exposure. And they start to come out when we're in the 40s or 50s. Because the cells that have been taking the hits from the sun are revved up, and they're producing extra pigment in a misguided effort to kind of block the UV light from getting in. But they're doing it kind of in an erratic way.
What we do first is to get a consultation with the person, evaluate their skin, find out what they like, what they don't like about their skin. And one of the first aspects of that consultation is to do what's called a computerized analysis, complexion analysis. And in that complexion analysis, you can see the sun damage, down here, the different spots that are noticed, the pore size, the amount of wrinkling a person has, those sorts of things. And then you can take this information and show the person the problem areas, and then you can help with them and decide what aspects of that we can improve. And so it's quite helpful having this individualized, computerized analysis.
Once we figured out what problem areas, if, for example, if they have a lot of sun damage and it's evident and very objectively scored by us, some of the treatments we had earlier talked about but can be used. In addition, those sun-induced brown spots, lenticos, melasma, is the medical name for those. They can be treated with a couple of different ways. There's prescription bleaching creams that you can put on, and that temporarily bleaches out the pigment, and it temporarily suppresses the cell's activities that are making those little pigment packets. But that really is a temporary treatment. The minute UV light comes and hits those cells, they'll overcome that medical suppression, and they'll start making the pigment again. We have a laser, an IPL laser called a skin rejuvenation laser, that actually permanently will decrease that pigment cell making ability. It doesn't blanch out all the pigments, because you don't want a dead white area. You want it to be normal skin tone. And that's what this laser does, and it's really really nice, very permanent. So not to say that you can't develop more in continued aging, but it really does permanently affect the ones that are there. So
and as you had mentioned earlier, depending upon how your consultation goes, they can decide at that point, even talk with you and discuss with you how aggressive or non-aggressive they want to work at.
So in addition to the laser treatments, which sometimes are individualized to spots, they can also be used over the whole face. And some other less technologic modalities that are used are cryotherapy, which is just freezing individual spots. So if someone has one little spot they really hate, they don't want to spend a lot of money, it's very safe, and it works quite effectively as well. So again, if you want to treat one spot or a lot of spots.
Can you get rid of flushed red blood vessels on the face then?
You can significantly improve them. Again, we have several different modalities. If you have just a few individual lines, some low-tech modality is cauterizing those. Again, the lower tech, a little bit higher risk, might leave a little bit more of a scar, a little lighter area, while the higher technology, the laser modalities, are a little less likely to damage surrounding skin, and can also be used for more diffuse areas where you have more blushing, that individual lines may not be as easily identifiable. And any one of these modalities have certain risks and also benefits, and can take more than one treatment to get them to go away. And as previously mentioned, throughout our life we go through a maturing process, and if your body has a tendency to develop these, they may come back again at a later date and may require subsequent treatment.
Thank you so much again.
Thank you. It was our pleasure.
Thanks. It's been great. Alrighty. Look forward to having you view other shows of Knowledge for Wellness, and visit my website at www.knowledgeforwellness.com and let me know where you viewed my show. And I hope we have provided you with more knowledge to benefit you and your loved ones. So until next time, be well and goodbye. Thanks again.